apnea is a potentially serious sleep disorder that can take a decade off of your life expectancy, and most of the people who have sleep apnea don't even know it.
Yeah, so joining us to talk about sleep apnea, the signs of it, and what the treatment options are, we have sleep apnea specialist, Dr. Suzanne. Hi, thank you so much for coming on.
Thank you so much for having me.
So nice to have you. So first, what is obstructive sleep apnea?
So obstructive sleep apnea is where you're gasping and choking and suffocating your sleep. You stop breathing while you're sleeping.
Wow.
The tissues in the back of your throat cover up your airway, and that's when you stop breathing. That's when you stop getting oxygen to your brain and to your organs.
Well, that's terrifying.
That is terrifying. Now, if I'm asleep, how do I know if I have this issue?
Yeah.
So really, it's very hard to know. There are a lot of signs and symptoms, but the only way to really know is to get a test, and you have to do a sleep study.
Okay.
And so to do a sleep study, you have two options. You could go to the sleep lab or the hospital, be strapped to a bunch of electrodes, and have someone watch you while you sleep. How does that sound?
Oh,
no thanks.
Creepy. Yeah.
Or you could do another option, and this is a home sleep test. This is my Aries home sleep test device. It's perfect. You take it home, use it in the comfort of your own bed with no electrodes, no one watching you, and it'll collect data overnight.
And it looks cool too.
Yes, it looks cool. Then you send it back in for an analysis, and a board-certified sleep physician will read the results and tell you whether or not you have sleep apnea. It's that simple.
Interesting.
Yes.
But you have a quiz, don't you?
I do.
Okay.
And so the quiz to find out if you have sleep apnea, these are some of the risks. So question number 1. Do you get drowsy or doze off while you're sitting and reading or watching TV? Or sitting in a public place like a theater or a meeting, or while stopped at a stoplight or a stop sign?
All right, not that serious.
Yeah,
But
not
if
that
I'm at
serious.
home watching, I don't know, nightly news, sometimes I can doze off.
Sure.
Yeah, true.
Yes, question number 2. Do you snore? Ask your bed partner or record yourself at night to see if you snore, because if you do, that's one of the biggest risk factors.
I don't, but I know somebody that does.
I know a lot of people do know people that
do.
Question number 3. Do you wake up feeling refreshed, or do you wake up tired every day, even though you thought you slept for 6 to 8 hours? Question number 4. Are you tired all of the time? And question number 5. Do you have frequent headaches? Do you grind your teeth?
Ooh. Ooh.
Yeah, it's a question that people don't realize. Yes.
Uh-oh, okay.
Interesting. Okay, so if we answered yes to any or all of those,
Yes.
then chances are that we have
It's
it.
very likely that you could. And so like I said,
Okay.
we definitely want to get tested. So I showed you 2 options.
Yeah,
but
so
then
now let's talk treatment.
Exactly, treatment. So treatment options. You can do the CPAP mask. Yes, everybody loves
Yes,
this, don't they?
yes.
But it goes over your head and over your face. And so it will give you continuous airflow. And so when it
Okay.
does that continuous airflow, it'll act as a stent to keep the tissues in the back of your throat open so that you can breathe.
Okay, yeah.
But of course, if you don't like the straps, if you don't like the air, if you feel claustrophobic, you could do an oral appliance. This is the option that many of my patients love because it's quiet, you don't hear that air, the noise, it's comfortable, it's small, it's convenient, you can take it anywhere.
Just comparing.
I know.
Comparing
Yes,
these
that's-
two.
They
like,
look just like they fit into your mouth.
They fit into your mouth, but what it does, it postures your jaw forward slightly, and it moves the tissues out of the airway, and that's what it does. And it's different for every single
Interesting.
patient. So at my office, we have, technology that can find that perfect sweet spot.
And
to
you
make
have
that
a
happen.
book, so
Yes,
let's
I
talk
do.
about that book really quick and how people can get it.
Yes, the book is called Snoring, the Clue That Could Save Your Life. You know how I said snoring is
Yeah.
one of the biggest risk factors? And so it's a big clue. But in that book, I talk about treatment options, signs, symptoms. I have a bunch of patient testimonials, and you can get it off Amazon.
Okay.
Very
and
cool.
Just SuzanneTye.com.
Yes, SuzanneTye.com. That's the website if you want more
Awesome.
information, but otherwise Amazon.com and just look up Snoring, the Clue That Could Save Your Life.